Dr. Kaylee MacIsaac, and I am the naturopathic doctor here at Acubalance. As a naturopathic doctor, I've done 8 years of schooling past high school. So I did 4 years of an undergraduate degree at the University of Waterloo in biomedical science. And I followed that with a 4-year medical degree at the Canadian College of Naturopathic Medicine in Toronto. I always knew that I wanted to work in some capacity in the healthcare field. I actually have a letter that when I was 9 years old, it was a school project, we had to write letters to ourselves as adults. And in that letter, I wrote, I'm sure by now you're either a famous dancer or you are a doctor. So first, on some level, I always knew that I wanted to be a doctor. Being part of the Acubalance team is like being part of a little family. We all really get along very well together, and I think it's because our passions are all in the same place. All the practitioners, we have a common goal for patients. We're always wanting to work from either a place of symptomology or a place of disease or pathology, trying to get our patients up to vitality. And I think the fact that we have that common goal in mind really helps us work well together. My role at Acubalance is to provide lots of comprehensive testing for our patients. So one of the things that I offer my patients is a whole bunch of in-office lab testing. So each time a patient comes to see me, they bring urine, I want to look at their saliva, I look at their blood. I really want to know what's going on with all of the systems of the body. Putting all of those things together really gives me a good idea of what's going on in a patient's individual environment, and that really helps us to discern the why behind their health problem. One of my favorite stories of a patient case that I've had so far working with Acubalance is a patient who came in and she was having trouble conceiving for the second time. Fulfilling my role at Acubalance, I was working with her to figure out what might be going on in her body. We did some extra comprehensive lab testing, and we actually discovered that she has a genetic defect in something called her MTHFR gene, which affects the way that her body processes and utilizes folic acid, which actually just meant that we had to give her a different form of folic acid than we would give the usual patient trying to get pregnant. So we did a couple months of giving her the proper folic acid, helping her with little tweaks with her diet. She was also doing some regular acupuncture with one of our acupuncturists here at the clinic. And a couple of weeks ago, we found out that she was pregnant, and she couldn't be happier. And I also, I was very happy that I was able to help her discover the why. Why wasn't she getting pregnant? We were able to reverse that, and it's just so fulfilling and rewarding to be able to do that.